According to VAC Kenya, 1 in 3 Kenyan females have experienced an episode of violence before attaining 18 years old, whereby men are the main perpetrators of GBV. Between 39% and 47% of Kenyan women experience GBV in their lifetime. Men are also GBV survivors, with reported cases rating at 5% boys and 3% men. For this reason, LV City Health conducted a multisectoral GBV training in Murang'a County to address certain gaps that hinder effective responses amongst GBV survivors.
A multisectoral gender-based training is where we bring in different sectors, that is health. We have brought in police officers, we have brought in the ODPP department, and we have brought in the judiciary. It's because we wanted these 4 sectors because these are the major sectors that are responsible when it comes to response and also to the justice of the survivor. So bringing in the 4 sectors so that we can learn together, we can share the challenges one sector has with the other sector, we can come up with the best practices from one region to another region, we can then come up with a good work plan which is across the 4 sectors to make sure that at the end of it all, the survivors who are seen in the health facilities, the police officers are able to come and collect forensic specimen. The ODPP is able to prosecute the perpetrator, and the judiciary is able to make their final decision or verdict about the perpetrator.
The children's officers are very key. They have their representation in this meeting. So basically we brought together the key players in the response of a gender-based violence survivor. And because we've had gaps previously, therefore we wanted each sector to tell us what are the gaps that they find with the others and such, so that we continuously improve on our performance in the service delivery to a GBV survivor.
We have learned a lot in this particular training. We shared the experiences. We learned about how Ministry of Health is handling these particular issues, and some of things are very new. Although the most important thing was we share the experiences and our roles we are supposed to play in GBV cases.
During this training, I have understood better the sensitivity of this GBV matter. It's become so rampant countrywide and especially in our county, Murang'a County. I have gotten the need for collaboration with other agencies that are key players in the GBV prevention and handling of survivors.
As a child officer, now I have a lot of networks, social networks within our county. I know whom to contact when there is need.
The reason we thought about coming up with this training, it's because we did what we call gender-based violence, quality assurance assessment in the health facility. And one of the gaps that was identified in the health facility was on documentation. The other gap was on forensic management. And the forensic management, it cut across not only in the health sector, but also it touches the police, it touches the ODPP because of how they draft their charge sheet, and also it cut across in the court because it's through the evidence that the court is able to make their final verdict.
From the point where the offense is committed to the closing of the case, the gaps are there. First, at the scene, how the scene is processed and handled from the word go. Most of the time you find that the people who reach the scene first tamper with the evidence, which would have been of much help if it was left intact for us to come and collect and handle it through the chain of custody properly. Another gap is the delay in reporting. Very many cases come reported late. This gives us a challenge, especially where treatment of the survivor is supposed to be timely. The 72-hour rule, especially for sexual offenses, whereby we are supposed to, we are expected to give medication to give pre-exposure, and also to collect specimens which will help us in our evidence on a timely note. When this does not happen, it becomes a challenge in court. The defense will be against us. Another challenge is local arbitration, that at the community level, especially when it is incest or it is a neighbor or a friend, they feel that they can discuss it, not putting into consideration the psychology of the survivor. Sexual offenses and gender-based violence is a permanent scar. And this, when arbitrated, leaves the survivor at risk of emotional breakdown at some point of their life. Sometimes they feel that justice was not done. But because the family came in and some community came in and they talked about it and they told them maybe to forgive the perpetrator, it's a challenge because eventually justice is not deemed to have been done.
GBV, the most common one is defilement, and it's very common within Murang'a, especially Kandara County. Those are many. And I know some of them they are just faced out within the community by kangaroo courts. They don't go through the justice system. We just learn a bit too late. When there are no evidence, no nothing, and there is nothing you can do. Those are the key challenges you have in defilement cases. But also, even in the courts, they take too long to materialize. And some of them are also thrown out of the set because of lack of evidence.
The most common of them is assault, especially IPV, intimate partner violence. It's reported almost on a daily basis. Then defilement, rape, sodomy, incest, and other sexual offenses that come along with gender.
Then, of course, we've also realized that sometimes the chain of custody of the documentation and the specimens for this client that are supposed to be analyzed are not accompanied by the police officer sometimes because of certain issues, either in the police station or they've been assigned other duties. And this again, because of the recommendations of the chain of custody, then we fail in that, and it also has a bad outcome in any case. Again, sometimes we've had missed commodities that are expected to be used in this, in what we call the post-rape care kit. So sometimes we've had shortage of items, but that one currently is being taken care of because we've advised the health workers how to manage that kit. Not necessarily the one imported that comes as a kit, but we make ours, just putting those items together and sealing it as a kit. Some of the other gaps identified were that sometimes cases take too long, and the health worker would be expected to go produce a PRC form, a P3 form, but then because of certain issues, either the defense or the perpetrator, the accused, then the cases go on for some time because they are postponed. And this has effects on the healthcare worker not coming later because there are certain duties they are supposed to leave for a short time, go deliver in court and come back. So when they are made to come several times, there's sometimes they develop lethargy and fail to come. So basically those are the issues, but this meeting is assisting us to manage because we are in communication, and we've even known how the prosecution will be able to talk to the clinician when the file is called upon, so that they don't come to waste a lot of time in court.
The initial stage of any case is reporting. The case could be reported by the survivor themselves or by any other private person who comes and makes the report. Most of the time, we are called to the hospital by medical practitioners when the survivor is gotten to hospital. In other instances, the community make a distress call. In other instances also, the chiefs call us and they make us aware that something is happening in their locality. When a report is made, we start investigations immediately. The most important part is medication as the immediate action for the survivor. We take them to hospital, escorting them, where they get immediate action, first aid, if there are any injuries, examinations are done. We fill the P3 form. We fill also the PRC form. We give pre-exposure when it is required. And we collect all the evidence that is supposed to be collected at that moment. After recording the statements of the witnesses, the survivor, and anybody else who was involved in that case, then we will apprehend the accused person. We process this accused person, open a case file, and present them before a court of law.
Gender-based violence is on the rise. According to the Kenya Demographic Health Survey 2022, Murang'a County, in terms of physical emotional violence, it's at 54%. That is very high in comparison to the national prevalence, which is at 34%. When you look at the sexual violence, Murang'a County is at 24%. Actually, Murang'a County is number 2 nationally after Bungoma, and our national prevalence of sexual violence is at 13%. And we can see Murang'a County is at 24%. It means in Murang'a County, gender-based violence is on the rise, and this is where we need a lot of community work to be done, because even if we are strengthening response at the health facility, what about prevention? So we need to work with all the other sectors, the community, the children's department, and all the other stakeholders, churches, because recently from that GBV quality assurance assessment, we also were able to reach to the community. And one of the major things that community members talked about is the stigma. People fear to talk about gender-based violence because of the stigma at the community level. The other thing they talked about is the lack of response from the police officers.
Oh, we need to form a good WhatsApp group for quick reaction. That will be, any minister can see, even children's band can see, and what the police can see, what have they done, and reporting system within ourselves. What about this matter? Where are we on these particular matters? No matter how many they are, we need to move to stop these guys. These guys need to zip up because they are destroying our children, our children's future. We have cases in hospital. We have one case in hospital, it was a bad one. And I don't think the girl will recover. And it's so bad. And it's the grown-ups doing that. You know, it's bad for our children to expose them to these acts. Those are inhuman.
I would like people to know that gender-based violence is a serious crime. It's a criminal offense. And when charged before a court of law, it has penalties that don't go very simply. I also would like people to understand that the offenses against gender is an offense against humanity. It injures the human dignity, and it forever remains a scar on the life of this particular person. They might heal, but they will never heal emotionally. So whatever it is, gender-based violence is a war that all of us should hold hands, collaborate, and feel sensitive about it. Work towards preventing gender-based violence.
I'm happy that one of our partners, LVCT, the BT, we cried to them to make this meeting happen, because we as a department would not have been able to manage the meeting. So our partners have been able to bring us together. That is one of the key things. Therefore, we'll discuss all these issues, all the gaps, and eventually come up with an action plan on how to reduce any gap that has been identified.
One of the main things we want to achieve as an organization, as LVCT Health, and especially as LVCT, the BT project, we want to make sure that the response, the GBV response in Murang'a County is strong. And when the survivors land in the health facilities, the documentation is done well, The collection of the forensic specimen is done well. The police officers are able to come and collect this specimen and the documentation, take the forensic specimen to the government chemist. Then they are able to make sure that the evidence from the government chemist is taken to court during the court hearing. And then the ODPP, they are able to draft their charge sheet well and present the case in court so that the survivor can be able to get justice. So for us as an organization is to make sure that we strengthen the capacity, the health system, and also the system for seeking justice for the survivor, to ensure that the survivors of gender-based violence, they get justice.